Hi, welcome to Case of the Day, and today is the eighth case. So we're going to end this week because I don't do Friday, Saturday, Sunday. And this is titled Hemorrhage in an Acute STEMI Infarct. So this 55-year-old had an acute LAD infarct 7 days prior. He was thrombolized intravenously on the same day, and then an angiogram 3 days later showed a severe LAD infarct. So yesterday he came for a cardiac MR for infarct and viability assessment. So you can see how there's hypokinesia in the anterior wall and septum. Um, there is some baseline hypertrophic cardiomyopathy, which is why the thinning isn't that significant. The late GAD images show a transmural infarct. It's beautifully actually seen on the 4 chamber and the 2 chamber, and you see these low signal areas within that represent microvascular obstruction. Obviously, the MVO is much better seen on the early enhanced images as these green arrows show. The stir showed edema, suggesting obviously that it is an acute infarct, but it is the multiparametric images that were just amazing. And you can see that here. The T1 image shows bright areas here, and you can see the signal drop on the T1 map. The T2 star shows these low signal areas. These therefore represent hemoglobin. Hemosiderin, and the T2 star map shows low signal. These values were about 9 milliseconds, so they were really, really low. So all these findings are suggestive of hemorrhage within the infarct. So we already have MVO, now we have IMH. Why is this important? Lot of papers, but this one was the latest in 2024. And this has that central image, which is these days very popular, which shows that if you have IMH, then you have poorer prognosis or a poorer clinical outcome. And our patient therefore had a large non-viable LAD infarct with MVO and IMH suggesting poorer prognosis. I've done of these cases at mricardiac.com. This was very earlier on, 2.5 years ago, where I showed the use of T2 star for this. And then recently I did one where we talked about MVO, but I also showed a couple of examples of intramyocardial hemorrhage. So infarct imaging is part of viability imaging. It's not about just saying whether something is viable or not, which is why CMR is so much better than PET-CT. It is important to look for MVO and IMH, and IMH is best appreciated on T2 star and T1 images and maps, while MVO is best appreciated on early enhanced images. That's my WhatsApp channel link. And thank you so much for viewing this and listening to this.